Hi everybody, happy Friday. It is the 18th of December and I can't believe that Christmas is literally 1 week away. It has just come up so quickly and before we know it, we're going to be ringing in the new year. So without further ado, let's get started with our announcements for today. All right, so start with some congratulations and praise. Happy anniversary to Anita, who is celebrating 3 years here at UVA with us on the 1st of January. And fun fact, Anita and I started on orientation the very same day. So we were literally the first people here who were brought into the unit brand new. So we share that little anniversary between the two of us. Also, congratulations to 2 of our Clin ones who completed portions of their orientation this week. Kate Wittig will be off on her own as an acute care nurse beginning Sunday, and Michaela will be off on her own as an MU nurse beginning Sunday. So please congratulate these 2 young ladies, give them the support that they need. If you remember, it's always a little scary to know that you don't have a preceptor right there, but we always support each other, so I don't think that there'll be a problem. So congratulations, ladies. We have a few more coming off orientation here in the next 1 to 3 or 4 weeks, so it's just going to be rocking and rolling. Okay, staffing update. So the request schedule is now live in Kronos. Please, if you haven't already put in your schedule requests, please make sure that you do so. You have 1 more week to do that. I wanted to let you know that Jennifer is no longer employed here in the unit at UVA, so I just want to make sure that you're aware this is not a topic for conversation, general conversation, and I just want to respect everything that's going on in people's private lives. A couple other staffing sadnesses that I have to report is that Shauna is going to be leaving us, unfortunately, on the 2nd of January officially. She's resigned. She's going to be spreading her wings and trying something new in nursing, and I'm excited for her and I'm sad for us. So please, you know, she unfortunately has been out on an injury leave for quite some time, but please send her a message of some love and support, as she will be greatly missed here in the unit. In addition to that, Stephanie O on night shift is also leaving us to follow her dreams in nursing, also the week of 1/2. That was her last official day. And again, greatly missed, especially on night shift. I wish both of you the best of luck, and just, you're missed, okay? So thank you for all that you've done for the unit. All right, unit updates. Okay, Christy is out on some well-deserved PTO beginning today and through all of next week. So if there are clinical concerns that you normally would have escalated to her, please let me know and I'll make sure that you get what you need. If I can't help you, I will find someone who can. So there's that, and then I will be in the unit on Monday and Tuesday as normal. Wednesday I work remotely, and then I will be available but not in the unit the remainder of the week, so for Christmas Eve and Christmas Day. I don't have another manager covering me. I'm covering myself. I'm still be on all calls, and if you need anything, text, call like normal. Don't be afraid to do that. I'm staying in town. I'm just gonna, you know, kind of hang out with my girls and spend some time with them. So let me know what you need. Okay, medical center updates. COVID surge, I know I've said it before and I have to keep saying it because it's still happening. We've been seeing over 40 admissions between 5 South and 4 South for COVID patients for the last 7 to 10 days. So really after Thanksgiving it kind of hit us hard. We're anticipating the same thing to kind of carry through as people continue to congregate, and you know, unfortunately COVID spreads that way, Christmas and New Year's. So for all of you who have floated, thank you. I mean, those words aren't enough, but thank you, because I know it's not easy, it's not always comfortable. You signed up to work here in our wonderful unit, but you're spreading the love and, you know, showing them that, you know, transplant nurses can basically do anything in other units. If you have feedback for me, please give it to me. I'd love to hear how things are going in those units. If you feel like they're doing something that's great that we can implement here, I really want to hear that. If there's things that didn't go well, the managers have all asked that we communicate those things to them so they can fix things if there are necessary. Okay. Don't forget the critical to safety CBL is due today. So if you have not done it, please take a few minutes and do so. All right, safety and compliance. Make sure you are doing your Who's Well health attestation every single time you come on grounds. Remember, this is a compliancy issue with Joint Commission and CMS. So I have to review those on Wednesdays, and if there are people who are continuously not doing these check-ins, I'm letting you know. Someone who misses one once in a blue moon, I'm not going to get super upset about that because I've missed one here or there, but I'm talking about people who continuously neglect doing it shift after shift. That is considered a compliancy issue and could be considered something that would cause us to put you on some type of remediation or progressive counseling. So please make sure you get that done. If you need help getting that set up, please let me know and I'll make sure you get it. We're also seeing a little bit of trouble, unfortunately, with some of our I's and O's. Dr. Brayman even, called it out in report this week, I believe, that our I's and O's have really been slipping. So please take the extra time to make sure you're putting in your I's and O's, you're clearing your pumps at least every 4 hours, if not more often if you have a lot of drips or a lot of infusions. Those one-to-one replacements that we're using interop. If you're not sure about any of those things, you're not sure how to use interop, you're not sure how to clear your pumps, you don't know if you're putting in your I's and O's, please ask one of the charge nurses. They are all highly skilled clinicians, or one of the, the Clin 2s and Clin 3s. Please ask someone for help. Ask someone to check after you if you feel like you might be missing something. That, for transplant, is one of the most important assessments that nursing can do to help the LIPs make decisions about, whether the patient needs a biopsy or whether or not we need to keep the patient longer for more medication, or if they need diuretics or dialysis, all of those things. It's important everywhere, but it's even more important in transplant. Kind of along the same lines, we've had a few incidences in the last week or two where 24-hour urines have been dumped, not collected, which requires that 24-hour urine test need to be restarted. We lose a lot of critical time that way. We're looking for creatinine clearance of medications, or we're looking for the medication levels and tolerance through the creatinine clearance would be a better way to say that. So please be really, really mindful if you have a patient who's on a 24-hour urine that you not dump that urine the way you normally would, that you collect it. Again, if you're not sure how to do that or what to do, please ask somebody. No question is a stupid question. We want you to be safe and we want our patients to be safe. So ask for help. And please be aware of that kind of stuff. If you know that you're handing off in report that your patient has a 24-hour urine, even go so far as to say, look, I have a 24-hour urine right here. Get your PCTs involved. They're very good at helping to remind us all to make sure that those things are collected. Okay? Team member highlight. Again, for everyone who's floated, thank you so much. Thank you. I appreciate it, and I know that the units that you go to really appreciate the help that you've provided as well. So, and lastly, our little magnet moment. I feel like house-wide, there's been so much that has happened this year. I mean, this year has been huge, right? With patients. Patient satisfaction actually has been pretty good, but employee satisfaction, I feel like at times has suffered, not just in our unit, but at a hospital as a whole. And I feel like we've tried really hard. I've seen some real positivity, especially the last 6 months. I feel like we've been better than ever, and people are just willing to help and have good attitudes and jump in. And again, you guys are the best, literally the best team. But if anyone has any ideas that can help increase positivity, increase overall retention, increase morale, resiliency, all of those things, anything that you think, hey, it might be little, but could we do this? Please let me know. I'm always racking my brain for ideas, and I'm asking you, share your ideas with me, even if you're like, oh, you probably can't do this. Hey, you never know. Maybe we can, or maybe we can do part of your idea and make it work. So bring it to me. Just pepper me with ideas. I'm open to hearing, and you know me, I'll try almost anything, as long as it's not illegal, immoral, or unethical. So with that, for all of you who celebrate Christmas, Merry Christmas. For anyone else, Happy Holidays. For anyone outside of that, just Happy Friday. Have a safe weekend, and I'll see you later.